A new study in the Canadian Medical Association Journal found that almost half of people who died with inflammatory bowel disease in Ontario died before age 75. Researchers used artificial intelligence to analyze the data and found that those premature deaths were associated with developing other chronic conditions by the age of 60, including arthritis, high blood pressure, kidney disease, cancer, or mental health issues. The lead author says that the findings show the need for comprehensive care. We were joined by Dr. Abhishek Raut, medical director at Appletree Medical Group, to further unpack this discovery.
How much of these findings will help with minimizing premature deaths associated with IBD?
Well, these findings are critically important because they shed light on an important aspect of IBD or inflammatory bowel disease that we haven't really focused enough on, which is really the interplay between IBD and other chronic conditions. So when we see that almost half of IBD patients in Ontario died before the age of 75, these premature deaths are really linked with developing conditions: arthritis, high blood pressure, kidney disease, cancer, mental health issues. And what it immediately tells us is that our approach to IBD can really no longer be siloed just under gastrointestinal symptoms. So I think it really helps us reframe our priorities as a profession as well. And really, we need to adopt a more holistic and comprehensive care strategy for our patients. So the use of artificial intelligence in this study, we've been able to see that this is really just the cusp of where we can see these data-driven insights, which will really help us identify high-risk individuals and really tailor interventions more effectively. So I think we're going to see a lot of ways how we're going to be able to minimize these premature deaths associated with IBD.
And why is the life expectancy for IBD shorter than for those who don't have IBD?
So I think firstly, when we would look at IBD, what we're seeing is that chronic inflammation is really at the heart of this disease. And this is an ongoing inflammatory process that's not just confined to the gut. It acts on a systemic way, and it gradually impacts the various organ systems. So over time, what we see is that inflammation is leading to serious complications. We're seeing cardiovascular issues, kidney disease, and certainly even many forms of cancer, particularly colorectal cancer. So really another major factor is a comorbidity. So the comorbid conditions at an earlier age, we see that with IBD patients as well. So these comorbid conditions can include arthritis, high blood pressure, but also mental health disorders. And by the time they're 60, these comorbid conditions are also significantly at play in diminishing quality of life. And then finally, I think we see nutrition as well as an important factor here. So IBD can hamper the absorption of vital nutrients, and that can also lead to a huge amount of stress for the body as well.
Now, the study also stated that premature deaths are considered avoidable through appropriate prevention and early and effective treatments. Now, what sort of treatments would you suggest to avoid these premature deaths?
Right. So I think treatment-wise, we're really focusing on a very holistic, patient-centered approach to that. So what that means is looking, number one, at an accurate diagnosis. So when patients come with symptoms that may be suspicious for IBD, the strategy is to get that diagnosis done right away. And that means screening earlier as well. Secondly, it involves treating very quickly. So there are anti-inflammatory medications like 5-aminosalicylates, which are particularly helpful in ulcerative colitis. There are immunosuppressive therapies like azathioprine or methotrexate that we use. And all of these will help control the inflammation, not just from the gut, but throughout the whole body. So those treatments will be in play here to decrease the load of IBD.
Now, Canada has some of the highest rates of IBD. Why is this?
It's a very good question. I think there's a lot of theories on why that is at play specifically in Canada. There is some thought of a genetic predisposition inherent in many Canadians as well. When we look at a population from a European descent, another big hypothesis is what we call the hygiene hypothesis, where what we see is in urban settings, children are less exposed to a lot of microorganisms. And over time, that might lead to a hyper response in the immune system. And then we do see some concerns about diet. So with the Western diet being a low dietary fiber in general, and more in refined sugars, and also a deficiency in general with vitamin D for us being up north, all of those at play likely causes an increase in IBD for Canadians.
And how big of a role has AI played in medicine, and how much has it changed or improved healthcare?
I think it's just begun. It's a transformative force in modern medicine. We've already seen in radiology and pathology, we have AI algorithms that are helping detect early signs of cancer, even subtle patterns that might escape the human eye. And there are predictive analytics powered by AI as well. So I think overall, this is just the beginning. We're going to see AI playing a bigger role in chronic conditions like IBD, heart disease, and diabetes. And what that's going to lead to, especially in Canada, is really looking at decrease in human error and ensuring patients receive timely and really evidence-based care.